A typical day for a resident starts early in the morning. You come in, start looking at your patients for the day for rounds, and then also working on your consults. And then around mid-morning, you'll go to rounds with the medical team, and that looks a little bit different depending on which rotation you're on, but usually you round with a medical team full of different medical professionals. We have lots of teaching opportunities, whether that's to the medical team through medical in-services or to the pharmacy department with continuing education programs that the residents will put together and then present.
The goals of our program here are to provide diverse opportunities for residents with direct patient care experiences and research opportunities. We also hope to provide residents the chance to enhance their management and leadership abilities, and also the chance to grow precepting and educating skills. This is done through not only patient education, but also education of staff and other healthcare providers. Baptist Memorial Hospital Memphis is a 700-plus bed tertiary care community hospital in Memphis, Tennessee. Because of our size and location, we have a diverse patient population with many disease states. Also, there's the opportunity to work with many different specialty physicians and providers. This scenario creates a valuable experience for a resident training. As a community hospital, we collaborate with consulting MDs to provide pharmacy services to patients. Typical consults include pharmacokinetic monitoring, nutrition support with TPN ordering, anticoagulation monitoring, and drug information support. However, in addition to this consult-based service, we also have many aspects of a teaching hospital. Many of our preceptors round with MDs and nurse practitioners in their practice areas. For example, this includes our ICU units, our malignant hematology team, our cardiac transplant unit, and the ERAS team, which focuses on post-op pain management. We also round with an internal medicine teaching service, which includes an attending, medical residents, and medical students. This models the traditional teaching hospital's layered learning experience. I feel like it's a huge strength to have both these training opportunities, both the consult service and the rounding teams, for pharmacy residents to prepare them for whatever career path they pursue post-residency. Our program offers multiple learning experiences for the resident, including a wide variety of electives. We are able to provide these in part due to our strong preceptor staff and the depth and variety of their professional backgrounds and training. These preceptors are on-site and easily accessible for not only clinical support but mentorship. Additionally, our preceptors have developed strong relationships with the physicians that have created an environment focused on optimal patient care that is easily set up for residents to quickly integrate themselves and continue the work alongside the multidisciplinary team.
I think that pharmacy helps us out on teaching rounds and clinical rounds to bounce ideas off of and to work as a collaborative unit. Typically we need some assistance in terms of medication dosing, and it's nice to have pharmacy on hand that's able to help us out with that, or even drug recommendations, and just make sure we're not overlooking things, and sort of a safety net for us in a lot of ways.
In our hospital, we have a decentralized model, so our pharmacists are out on the floors, we're all over the place, all different areas of the hospital. That really helps us be right where the patient is, and the main things that we're proud of is the degree of clinical services that we have here. We try to do everything that we can per a pharmacist-driven protocol, and all the things that just should be taken care of for the patient, we try to make that happen so that we can save our time talking to physicians with things that are in the gray, the things where you really need to have that conversation with the physician. We have a lot of support from both our physicians and our administration to push those pharmacist-driven protocols through. And a lot of that work also has to do with our residents' research projects. Our residents provide a lot of data and a lot of information that really is the backbone for pushing our next clinical service. I think one of the real strengths of our program is that you get to be here and you get to experience taking something from just an idea all the way through implementation. So you'll see how we go through collecting data, developing a concept, turning it into a new service for our department. One of the other things we do is work really well with our system pharmacy team, and I really enjoy that work because you get to collaborate with pharmacists all across the system. So you learn something that's working well in another hospital, you get to bring it into our hospital here at Memphis, and we do the same with the other hospitals.
I chose Baptist Memphis because here you have a unique opportunity to experience a plethora of different rotations while working with a diverse patient population. I also chose Baptist because of the culture here with pharmacy. The support that you get from the other departments and other healthcare professionals here is really outstanding. And that, coupled with the determination of the pharmacy department, actually leads to innovation in pharmacy practice that impacts patient care. Here you also get mentors that are other specialists that help to guide you in your journey to become a better practitioner. Overall, Baptist Memphis really gives you all the tools you need to become a better you.
One of the things that I love the most about being a part of our residency program is that every preceptor here is committed to our residents stepping out of our program and into clinical practice. Whether that is walking into your PGY1, possibly going into fellowship, or even starting your new clinical position, our goal is to get you capable and confident that you can do that. The way that we do that is ensuring that you are continuously advancing in your autonomy throughout the entire year, whether that's your rotations or your longitudinals. And that's one of the things that makes me proudest about being a part of our program and knowing that we're putting out really excellent clinical pharmacists every year.
I did my residency here at Baptist about 4 years ago now, and this residency actually helped me prepared to step into the PCAP role, which is pharmacy in the patient's care area. Residency prepared me in essence, in the sense of being ready to be on the floor and answer whatever questions the nurses or even sometimes physician will ask regarding patient care. Also, an important part of being part of the residency program was that I was able to work more efficiently when I became a PCAP. In terms of reviewing the patient and seeing the specific needs in ways to further enhance patient care.
When I was looking through residency programs, I was trying to find places that would challenge me intellectually but also give me a multitude of opportunities. Baptist kind of fit that schedule. So I also was looking for places that I could have opportunities to work on Code Blues. And Baptist had a wonderful on-call pager schedule, and that was really excited about. Mostly my love for Baptist came from my interview. I met all of the people here, and I really clicked, and I felt like the people at Baptist, the pharmacists, are so well respected, as well as they're very comforting and caring to all of their residents, and you could really tell that whenever I came by and interviewed.
Our residency program offers a variety of rotation experiences, and we really allow our residents to take full advantage of all these electives. We have just a few required rotations that they have to take, but then they really get to pick what they want according to their interests and their career goals. I think also our setting of being in a large community-based hospital that has teaching components really gives them a variety of experiences that's going to benefit them in their career. They can really go on to work in any setting. And we also offer quite a few presentation opportunities as well as even extra publication opportunities, and these are also things that give them really good experiences that'll benefit them afterwards in PGY2 or their next step in a job.
I completed my residency here at Baptist back in 2015. I had the opportunity to stay on and become one of the emergency medicine pharmacists, and now I'm one of the lead pharmacists here. So I actually oversee a lot of our emergency medicine pharmacists and our clinical pharmacists upstairs. We have plenty of opportunities here in the emergency department. It's part of our staffing opportunities for you all. As far as staffing goes, there's multiple opportunities in our order verification upstairs in our main pharmacy. You also have opportunities to work with our clinical pharmacists in the evening, but also down here in the emergency department. So even if you're not maybe interested in emergency medicine, you still have the clinical opportunities to be able to see what we do down here in the evenings when it's definitely busy.
As a program, we're looking for residents to be advocates for patients. We're looking for motivated pharmacists who are always looking for ways to improve not only patient care, but services offered by the pharmacy department.